session, so we can, I can send this to you after, so that at least, this will be useful. Okay, so let's start. So HMG, so IMS is installed on a terminal server client kind of model. So as long as you have that icon, we should be good to go. There is no need for any installations of like separate, softwares or anything. So you should pretty much be able to access right away the whole software. So once you log in, once you have your username and password, log in.
Chris, are you sharing your screen yet?
Oh yeah, that's important, isn't it?
There you
go. So sorry for that. So yeah, I just shared my screen. Can all of you see it?
Yes.
Okay. So this is the icon that I was just mentioning about. So this, as long as you have it and you double click on it, put your username, password, you should be good to go in any computer. Now, when it was installed by the Baton Rouge Hospital IT, there is a different way that the people inside the hospital access it, like in their network, versus outside, like anyone who is living across the street or, Ace or myself. So, but, it should be very similar. So you should request them for the access. Now, there are two access that goes here. First is for the server itself. That will be given by Baton Rouge Hospital IT. And second access is once you log in, see this IMS icon. So there is a username password for HMG, then there is obviously Lima. So if based on what Michelle wants and Dr. Banda, who wants access, so both accesses are different. Like you can have access to HMG and may not have Lima or vice versa. So anyway, so this access can be the hospital doesn't create this. This was technically being created by HMG upfront, or I can show you how to create this access, Michelle, in a separate call. Or at this point, if you need someone, you can just email me and I can create them. But I would definitely would like to show you, because I'm sure with that many staff, things change all the time, right?
Yes. Yes.
Yeah. So I'm going to log into HMG, and I'm going to log in as an admin. Okay. So Ed, I'm going to go over just how the look of IMS is, and where you can find the main things, and then we go into details into different modules.
Sounds good.
So once you log into IMS, there are two ways you can access, different, check-in, check-out schedules or billing screens and stuff like that. So the top icons are like your shortcuts, so where you can click and reach, majority of the things that are useful. And on the top, you see the menu, which has the same things. So if you see this diagnostic lab order tracking, you will see the same thing here. But this obviously has like a lot more options, like if you want to go into detail items under billing or reports and stuff. So that's how you access different things. Now let's start with creating a patient. So the first icon, if you click on that, it will open this screen where you can create a patient. Or if you go onto the top now, as soon as you hit this particular screen that you want, then there is a new ribbon item where you can search or new options. So this first one with the binoculars is definitely, if you want to search a patient, let's say test, so and hit search. So as you can see, we can just do the last name, or you can do like last name, comma, a part of the first name, or the full first name. So once you click search, it's going to pull that. Now you can just clear this, or you can search it by anything based on their phone number, date of birth, SSN, pretty much anything. You can search. Let's go with that, and it's gonna, let's suppose this. So there are, like, as you can see at the bottom, 32 patient records with the last name Test. Let's suppose I'm searching for Test Ed, right? And as you can see, nothing is found. There's no patient with that name. Then you click Add Patient at the bottom, right? So clicking Add Patient will bring you to the similar screen that you saw when we opened the patient screen, right? Then, so I'm going to cancel this. And so this is the screen to create a new patient. So we will start creating a new patient. So in this screen, we pretty much have different sections. So that basically the first one is the name and Social Security number, then the address, then the race, ethnicity, and language stuff, then the miscellaneous stuff like the primary care doctor, or do we have to bill them or not, and finally the insurance, right? On the right-hand side corner, we have a few more options. We will look at that as we go along. So let's start creating a brand new patient. So what we did was we clicked on this icon and it opened the screen. So I'm going to start. So you can pick an office name where the patient originated. So, your GPAM, or let's suppose, let me pick something, which is Mid-City Medicine Clinic, right? So Mid-City. So they are the thing, and once you pick that office, the physicians that go under them changes, right? So let's suppose Mid-City Medicine Clinic, you can see all of these people that work there. Let's suppose Landmark SNF, you only see these people, right? So based on that, it changes, which physicians are supposed to be working at a different practice. So let's pick that. Let's say Dr. Banda, full name, first name, I'm going to say Test, or let's say first name Ed and last name Test. Okay. So anything that has like an asterisk next to it is kind of like a mandated field. Anything that does not have an asterisk, it's not mandated, and that is customizable. So if you say, Chris, we would like to make the Social Security number mandated, then I can change that. So just let me know. But sometimes patients don't have that, and it's maybe hard to make that mandate. So let's suppose I'm thinking you're at least 36 years old. So all the zip codes in pretty much every country, pretty much every state is loaded. Now, cell phone number versus home number, it's good to take more numbers. Obviously, that's what we have now. And here, you have to mention a preferred phone. So in this case, cell phone, for example, or preferred communication. The only reason for that is tomorrow, if we have like an automated system where we are texting people and stuff like that, or calling people to remind them about their appointments, then the system will go for the preferred phone number for appointment reminders and stuff, right? Fax number, and the mailing address. If the patient's mailing address is different than their address that they gave us, then obviously you can change that. So you uncheck this and put a new address that's supposed to get the mail. Mostly used for pediatric patients where the bill may go to someone else. Obviously the race and all that stuff. So other things are not mandated, and they're based on your office requirements. So if you need to know the education status or driver's license, you can fill them, or you don't. Patient type. Patient type is useful in IMS for any kind of reason. So if you want to categorize, let's suppose you have a new deal with an insurance company and you want to track those patients so you can run reports on them tomorrow, or you want to track a certain kind of patients, all the patients with self-pay, or any kind of tracking that you want to do patients where you want to group them, you can create a new patient type and say, okay, I want this patient belongs to mental health insurance. And also you can pick one or two, so you can put them in two categories if you want. Okay. So in that way, tomorrow, if you want to run a report with all the patients with that insurance or that self-pay discount or whatever, you can do that. Primary care doctor, for your specialist, you obviously have to track who the primary care physician is. Now, as you can see, anything that has like a question mark next to it in the system, once you click it, you will have more options to search. So you can search by their UPINs or specialty or fax numbers or phone numbers or last name. So, and if, let's suppose you don't know, you want to just get the whole thing, then you just hit search. So we have about, without any fields in them. Or you can sometimes just put a percentile sign so it searches everything. So these are all the physicians in the, supposed to be the referring physicians. So we can pick someone. So this is the referring doctor who sent this patient to Dr. Banda. Now referral source is different. Referral source is kind of used for marketing purposes. So if you, I don't know what was created so far. I can see people are confusing and sometimes putting referral physician here. But referral source is you put an ad on the TV and you want to track all the people that's coming from the TV ads, then you can create referral sources, like how you're getting it, or a hospital name. Anything that you want to track, like how many patients I'm getting from such because of my marketing efforts or whatever. Bill to is obviously, as it says, this is a patient, but I want the bills to be sent to a different patient. So you can click on this icon and it opens up the screen. So this is a patient, but I want the bills to go to somebody else. Right now it defaults to test at patient, but let's suppose you want to pick somebody else. You can pick that name and make the bills go to that patient. Okay. Housing type and all this again are all specific. Self-pay is already checked because we haven't added an insurance. If the patient is deceased in the future and you know that, then you can put a date. Fee class, this is if you have like fee schedule classes and you want different people to have different fee schedules, then you can say, okay, this patient can be under that fee class, but I don't think we use that right now in IMS. Patient statements, if you know this is a patient that, that you don't want to get a statement for whatever reason, then you can say no. Okay. Statement code, and these things are not used right now. This is like, if you have like, first statement letter saying, hey, you have to pay right now, or patient 2. So if you want to overwrite, what the system automatically does that, like the first one is a slow collection, second one is a hard collection letter. But for some reason you want to change that and you want to put a reason here saying this patient has to pay, this prints on the statement. So whatever message you want to go on that. Note is a generic note on the whole patient. And this is when we are looking at letters. So any of these fields can be drawn, dragged and dropped to create a letter. So if you want to add some notes like on the patient's name, you can definitely do that. This is not to be confused with appointments. Like when you're making an appointment, you make a quick note saying, whatever, abdominal pain or chest pain patient is coming in for that. That's not this. This is just on the whole account. Okay. Like, this is Dr. Banda's brother's son, don't bill him, that kind of notes or anything like that. Okay. So once you're pretty much created all that, the final thing would be adding an insurance. So first we will look at how to add an insurance which is already existing, and then we will look at how to add a brand new insurance which is not in the system. Now, for a brand new insurance which is not in the system, I would really like for the billing company to add it, because there are multiple other things, the format and the payer IDs and stuff that goes with it. So I would rather not have the front desk add it. So you can send an email to A saying, hey, can you add this insurance? And they will make sure all the other things that go around creating an insurance are taken care, right? So let's look at how to add an insurance which is already existing. I'm closing that, so I'm going to add. So you double click on this bar which says insurance. So this opens up directly to this point where you can add that insurance, and you can start typing. Let's suppose this is Medicare. So it sorts out what you're looking for. You can also do a drop down and say, okay, I'm looking for LA. Okay, and you can then put their Medicare number. If there is, as you can see, the insurance name and ID are mandated, other things are not. Then if there is a group name and group number, you can put that. The system automatically thinks this is primary because this is the first insurance you're adding. Start date, end date, if you know that, you can add that. Definitely useful when you're like ending an insurance and adding a new one. But for the first time you're adding it, then it may not, be as much of a requirement. Relation here is important. That's where who this insurance belongs to. If this is self, then you don't have to do much. But this is like a spouse's insurance, then you have to put who the insured by is. So then you click on this question mark and try to find the contact. If the contact is not there, or the husband account or wife's account is not there, then you click on add contact, and you create, you don't have to create the full thing. It will just ask for the person's name, and their phone numbers and date of birth. Those are the important things, so that the second, the primary responsible can go. Let me cancel that. I'm going to make this self. Copay type, if you know the copays, you can put them, the general copay and specialty copay. Generally the card has it, so generally people don't put that, but if that is something you want to enforce and make sure that the patient is collected, then whatever numbers you put here will show up as a highlighted when the patient is checking in. So you can add that if you want. Obviously notes and stuff. So when you're adding this insurance, you want to check their eligibility. So then you can click on a send inquiry. Then the system goes and let me see. So it as soon as you click this, it's sending an inquiry, and it came back. Obviously, it says error because this is a dummy patient and all those details are wrong. But you will see the result has passed or failed or active or not. So when you're adding the insurance, it's a good thing to check. But again, not all the insurances support that, but majority of them does. I'm sure 80–90% of them does. So you can use that. Now, if you click on eligibility history, it will show this one that we just did right now, and maybe any past eligibility checks that we did. So you can see all the past ones too. And if you want more details, you can click on this icon, and it will give you a lot more details. But right now, this didn't come out, so there is nothing to show. But you will see an icon like this, as you can see at the bottom. So then you can see all the details of co-pays and co-insurance amounts or whatever that insurance is willing to share. Okay.
Hey, Chris, okay. One quick question.
Yes, Ed.
Is there any indicator on the insurance name or anywhere that tells us whether you can test eligibility or not? On the plans that we test eligibility, what will it say when we try? There you go.
It may say that the thing, this is not supported. I haven't seen one lately without, supporting the insurance thing. So, but it will say that, it's not supported or something like that. Okay.
Okay.
So on the top here, you can see where you can scan a card. So once you're creating that insurance, you can click the scan a card, and you just hit start, and it will scan that card and create a duplex of back and front of that particular insurance card. Okay. So now if you want to add the secondary, you can click on add. Suppose this is AARP, the system thinks that this is a secondary one, and you can change it if you don't want it to be secondary and change it to something else. Okay, so once you hit save, and close, you will see those two insurances here in primary and secondary. I'm going to look at quickly how to deactivate an insurance and add a new one. So let's double click on it. So let's suppose MHM behavioral health is not active anymore. So what we do is we double click on it. First step is to make it deactive. So take the active box out. And at that point, the system is asking, hey, there is no secondary primary, but there is a secondary. Do you want to make that primary? I'm going to say no, because that's not what I want to do, because I want to add like a brand new one. At this point, I would like to add an end date, because this is after a few years or months that we are going to end something. Save it and click on add. And this time the system thinks you're adding a primary because there is none. So let's suppose that's the insurance that we want to add. Yeah, and this time I would like to add a start date, because, you know, for the claims purpose, so that billing companies can know which insurance to bill based on the date. And you hit save and you hit close. So once you do that, the new primary is there, new secondary is there, and you scroll down, you'll see the red expired primary. Okay. So those are pretty much all the options creating an insurance, demographics of a patient. On the right-hand side, you have some more features that you can add on top. The first one is the same insurance, so you can click on here or you can go there. Contacts is like if you want to put emergency contacts on the patient, employers or any allergies that you want to add, documents that you want to scan, or if you have like a checkout, like a kiosk kind of thing where you, like in Walmart, you know, where you can sign off your, you know, after you use this. So you can click on the sign. So if there is any patient forms that need to be signed, you can, you know, get them signed. Billing info, just to see where the, you know, how much the patient owes and who is getting the bills and stuff like that. If you want to create any payment plans, so then you can create the payment plan saying, okay, this patient is going to pay every 1 month, you know, on the 15th day of that month, he's promised to pay $20 starting this day. Okay. So if there's any payment plans, you can set up those here. Any immunizations that, you know, that you want to see where the patient is getting or want to document. Office chart number is basically, you know, if you have a different account number that you want to track. This is generally used when people are coming from a different system and they want to track their old chart numbers or account numbers. They can use that. Other options in this case is also important. So if you click on other options, you can see all these people have access to this patient's chart, but you don't want Dr. Zuckerman to have access to it. You can uncheck this so that, you know, he won't have access to it. Okay. So, or you want only 1 or 2 people in the whole thing to have access to it, you deselect it and just highlight the people who you want to have access to it. Okay. Email notification. So, you know, if you're doing email, you want the patient to get notified on all of them, or let's suppose they say, I don't want billing statements to be sent through email or portal reminders and stuff, you can uncheck those. We haven't, Michelle, one thing I was talking to Jerry and everyone in the last 2 years is your patient portal. That was never implemented, but I think that's something is important, so we should do that, you know, as soon as we can. Okay.
Okay. Is that something we can do through IMS?
Yes, yes. So what happens is, we can just put a link on your website and patients can go to the portal and access all their documents and stuff. It's kind of needed for the macro and MIPS, but last year, I think there was some issues and it was never implemented because I think it was not approved, basically. Okay.
Okay.
From what I remember last time, Michelle, IT was supposed to give some quote on or set up the server last time, and I haven't heard anything from them. Okay, so just so you know where we are with that. Okay, so once we create, sure, thank you. Once we create all this, we just hit save. So once you hit save, you cannot change anything. As you can see, everything is, you know, kind of, you know, frozen. This happens to anything in the system. Once things are changed, we don't want accidentally people to change something, but you can obviously edit it by clicking this icon on the top. right in the middle, which says edit. So click edit, then you can change anything. The only reason to do that is because sometimes people accidentally type something, and it changes. So we want to make sure that they mean it by clicking this edit button and changing anything that they want to change. So then you can click this and you can add a new patient, or you can delete this record. Again, I won't suggest deleting anything in IMS. I would say make them inactive, whether it's an insurance plan or a patient or a doctor or anything. Everything has like an active button. So just uncheck that. Obviously, you have to click edit, uncheck that, and it will make that inactive. Okay. So any questions on the patient demographics creation and insurance creation?
No, I don't think so.
Okay. So then let's move on. So that's the first icon we saw. These two icons, we can come back. These are other icons that we'll go into more details, like visit notes, labs, and prescriptions. So let's not go there yet. So we'll come in a process where the patient called on the phone and you just created the patient's account. So the next thing would be to make that appointment, right? So let's go through that process flow, and we can see any other things. So making appointment is this icon right here. So you can click on that icon, or you can see there is an F9 button right there. If not for all shortcuts, I recommend people to remember those two shortcuts, which is F9 for making an appointment, and F10 is when you want to check in a patient, right? So we will look at that later. So let's go with F9 first. So we just created a patient, so we have to make that appointment, right? So I'm gonna, so in this appointment creation screen, you can see the calendar. So you can make an appointment for today, or let's suppose for next month on 20th. You can go there and you can make an appointment. And anytime you want to come back to the existing date, you can click on this T for today, and it brings you right back to today's date. This arrow, single arrow, will take you exactly 1 month to the 1 month ahead. So instead of January 2018, you click that, it will take you to February 2018, and so on. If you want to go like 1 year ahead, so that would be the two arrows. So it will take you to 2019, March 18. You can always come back to this. We will hold off on this for a second. Office is, based on if you want to make an appointment here or some other office, so you just click that, and it will show you the physicians who are working in that office. And if the physician is not, working on a particular day, the schedule will look a little different. So like that. So this on the top, you'll see a note saying the doctor is not available that day. So let me see which day they are available. Looks like for Kristen, there is no schedule at all created, okay? But for Care Center LTC, they're open every day, schedule-wise, from 6 o'clock all the way to 2:45 or maybe more. Yeah, all the way to 6:45, okay? Okay, so it's under car for today. Now, if you want to have, let's suppose a patient calls and you have to make 2 appointments, one with a physician, one for maybe some other service, then you can check this allow multi-select at the bottom. Then you can say, okay, I want to see both their schedules like side by side. Then that's how it shows. So then you can make an appointment for 12:30 with Care Center, and then right after that appointment at 1:45 with Kristen. And you can keep going on like that. If you want 3 of them, then, just keep going, to check everything, right? So let me uncheck all those and refresh this. Now, day means you're looking at the day schedule. Obviously, week means you're gonna look at this person's schedule for the whole week. I wouldn't recommend doing like a month. I mean, you can click on it, but that's gonna look so small, okay? So let's go back to day. Okay, so now on the top hand, if you see same thing, if you want to search, print, move back and forth, like next month kind of thing. This is like a classic view. Some people, for some reason, like this kind of view. As you can see, the timings change a little bit, right? The way it looks. but this one is a modern view, so whichever one you like. Now, sometimes patients just call and say, hey, I just called to ask when my appointment is. That would be a screen, this button right there. So you are on that appointment, and somebody calls and says, hey, can you tell me when my appointment is? So let's pick her. So you can say, oh yeah, you had appointments on so-and-so days, and the next one, or you don't have anything because the last one was November 16th. Okay. And the status here shows if they came in or they missed their appointment. Okay, so this is a dummy patient, so majority of them doesn't show. Now, you may be asking, Chris, but what is PMINS status, right? It doesn't make any sense, PMINS pass. Now, anything that has like shortcuts in IMS will always have at the bottom, it will show details of what that shortcut is. So in this case, P means patient canceled. If it says M, that means they missed the appointment, D means provider canceled, and so on and so forth. Okay. So let's close that. So that's taking appointments. These are reports that you can pull, saying, let's suppose I want to pull all the appointments. I mean, there are other reports, but this is quickly if you want to do something like, I want to see all the reports for these 3 offices, and you click OK, it will show you all the appointments there. I will explain more about reports because the IMS reports are amazing. So it has a lot of filters and stuff, so it will take some time for me to just explain that. Refresh the screen. Sometimes, if 2 people or some offices have like 10 people making appointments, so they may already be blocking like 11:15 and trying to make an appointment, and somebody wants the same thing, then you try to refresh it. Otherwise, it's okay. Dashboard for schedule. We can come back to this. Dashboards are like quick graphics that we can see, and we'll come back to that. Settings. Parameters are mostly in control of admins, but I can quickly show you what parameters are there in scheduling. I mean, there is a lot of flexibility to customize, sometimes too much flexibility that you don't need. So if you can see, like, do you want double booking to be done, right? Allow double booking in your office, or do you want, allow to change statuses, or what view you like, Outlook appointment view, or which one. And so a lot of appointments, do you want to see like daily appointments, or do you want to see something else? So a lot of options, that, as I said, if you ask me and say, Chris, can we do this in system? Then I come back here and look, which ones to look for. Like colors that you are seeing, any colors can be changed and all that kind of stuff. Okay. So generally, these things are done during the setup initially, so it's all done. I wouldn't change them now. Okay. So let's start making an appointment. So we looked at all the options. So we clicked on F9 or this icon. So I want to make an appointment today for this office at 11:15. You basically double click, find the patient. So in this case, let's suppose test comma ed, and we created that patient already. So as soon as you make this appointment, it will say, hey, these are the addresses and stuff, so you can quickly check that. And this office and this physician offers these procedures. So let's say this procedure is a follow-up note, and you can say, why is the patient coming for this? Abdominal pain. Okay, and based on how you want the appointment to be reminded, you can say the office will take care of it. As you can see, that's the default because we haven't set up any IVR systems or emails, okay? Because majority of yours are hospital visits, and the other ones, I wasn't approved to do setup. So basically, they're not reminded right now in any form. If you know this procedure and this insurance needs a pre-authorization, then you can just say this is required, and this will go into a different inbox of whoever that person that does your authorization, so they can go back and work on those if you know that this needs a pre-auth. Okay, so then uncheck that. Now, you may have created that patient test ed like a long time back. So when you double click on the screen, you can see what insurance they have. So you're basically asking the patient, hey, are you still at this address, and is Medishare and AARP still your insurances? If they say no, I'm not using Medishare now, then you can double click on the insurances and just still come to the screen and change that and check their eligibility verification and do all that. And if your office have a policy of checking eligibility verification every time you make an appointment, which is the right thing to do, then you can, while making that appointment, hit the send inquiry and quickly make sure that they're still on that same insurance. The other thing you will see a lot throughout IMS, I call this Wally. So anytime you see this guy's face, you click that, it will show you like a ton of options. So pretty much you can go to anything in the system without like trying to move away from the screen. So if you want to go to this patient's ledger because you're telling, hey, you need to pay the balance, or if the patient, while making an appointment, says, hey, was my fax sent for such and such thing, you can look at all the faxes that were sent. You want to create a letter. Let's suppose you're making a new appointment and you want to create a letter saying, hey, welcome to our office, blah, blah, blah. Then you can create that. Or just look at the patient's chart or the documents, so pretty much anything. So you can go from here without closing the screen. Okay. So, and you just hit OK. That creates this patient appointment. So as you can see, this was not given any color. So every procedure has a different color. As you can see, this one was created in red, but the other ones were not given any color. So if you, based on that color, it will look a little different on the screen itself. Now, once an appointment is made, you can right-click, cut, and paste, just like in any Word document. Or, so let's suppose they say, oh, I don't want to come at 11:15, I want to come at 2. You just like cut and paste it. Not only the same day, you can go to a different day on next day, and you can just hit paste there. Okay. So that we don't play too much of the system, I'm just going to paste it here. The system is going to ask, hey, why are you moving this appointment? Just say patient cannot make it or whatever. And you can paste it at a different time. So that's how you reschedule appointments. Right click on it, and if you want to double book, you can click double book right there. And let's quickly double book someone. Do this account. And this one, let's say follow-up node, and hit OK. Saying that there's already somebody there, which is fine. So it kind of looks side by side now because you have two patients at the same time. Then let's see. Canceled by patient, canceled by provider, if that happens. Now, let's suppose, doctor care center, in this case, says, oh, we don't want to see any patients from 2 to 4 on this particular day. So you can just right-click it, go to multi-block reserve, and pick the slots that, I said 2 to 4, but I'm blocking different slots. So basically, they don't want to see patients from 10:15 to 11:45, and this is on random, on the fly, right? So, it's not like schedule, you just call and say, I want to block my schedule. So you just hit that, playing golf, and that blocks the schedule like that, so there won't be other appointments there, okay? And as easily as you blocked it, you can do the unblocking too. So you go back to the thing, pick all, sorry, not that one, pick all the ones that you want to unblock once it's blocked. Now, I would do this only for a particular day, like particular day for a couple of hours kind of thing. I wouldn't do it if it's like multiple days or multiple slots. There are different ways to do that. And one is you can go under this multi-block reserve. Instead of picking the hours, you go to multiple days and say starting from Jan 18th to 25th, 12 a.m. to 1 p.m., not 1 a.m., whatever. And you click on add and you say, okay, every week on Mondays and Wednesdays, I want to block this physician from whatever that time is. Okay, and you can give a note. So that if you want to do like multiple days, okay. But there is another way to do this too if you want, but I'll show you that to you later. So that's how you can block schedule. Driving directions and stuff are fancy to have, but forms to be filled. So at this time, if there are any forms that they have to be filled, you can do that, or you want to create a letter. I think we talked about that. So you can print any particular letter. So you have to have the letter already created. So for example, HIPAA consent form, whichever one. So you can just then hit print, and you can print for the whole schedule for a whole office, for a whole provider, or particular kind of statuses or particular kind of procedures. So you can then print letters in bulk if your office does that. I think that's pretty much all the options while making appointments. Any questions on that?
No, that's good.
Okay. Can you, I mean, is this like more detail? Is that what you're looking for, Ed, or am I going into more details that you may not even need?
He had to step out for just a second, but that's what he said that he was looking for. We just kind of wanted to get an overview of, you know, how to start these things.
Got it. Okay. So then, yeah, let me know if I'm like either going too fast or maybe too much into details. I never like deleting appointments. I generally like cancel them or something, but deleting like takes all the history out. But if you like make them canceled or cut or copy, there's always history in the system that you can see. But in this case, actually, you know what? I'm not going to delete it because then we can play with the check-in, check-out. But I'm going to eventually delete these appointments because these are dummy. So your appointments are made. And again, appointments can be made like a week before, a month before, a year before, right? But now the patient is in front of you. Now you have to check the patient in after like 6 months of making their appointment. So that would be F10, right? So once you're in F10, this is the check-in, check-out screen. This is where the front desk actually is looking at the schedule and waiting for the patient to walk in. So this is the 2 appointments we made. So if you look at the screen on the left-hand side are all the appointments that are yet to come. The middle screen are all the appointments that are already walked in. When you walk this patient in, they will jump into the middle screen. We'll see that in a second. On the right-hand side are like, you know, other quick stuff like if you want to walk in a patient, you know, doesn't have an appointment, they're walking in, they're checking out, or they want to pay their copay, or you want to print a super bill, you know, or you want to take their vitals really quick, that kind of stuff. So these are like shortcuts. Now, if you take the patient's picture, you know, with a cam, some offices do it, then you can see the patient. Yes, Ed.
I could be wrong, but I don't know if we need to see this today. Michelle, we won't be dealing with appointments, will we?
No.
Yeah, so I don't think the appointment scheduler is anything that we need to see.
Okay, sounds good. So, okay, so this is the F10, so we're gonna move away from this. Let me open your email, and I just want to make sure I'm covering the ones that you're.
What about basic charge entry? If we have a few sample hospital charges just to do the actual data entry.
Okay, so let's go into billing then. So you see these icons here. Anything that has a dollar sign deals with billing, and this is in the same flow as how things happen, right? So the first one is charge posting. Then once the charges are posted, you send the claims to insurances, so that's claims. Then ledger, you know, that, as the name says, you can look at the patient ledger. Then the insurance payment posting, and finally the AR screen. So let's go to charge entry then. So you click on the screen. This opens up all the charges. Now, generally, because all the physicians are technically in the office supposed to do their, like pick their 99213s or whatever that is while they're doing their visit note. Generally what ACE does is they go into to be billed screen, and this shows, let me hit retrieve. This, I did it, okay. This shows all the charges that need to be entered, and they'll pick from here and bill them. Now this is from like ever, so don't think, you know, these are all pending. These are, as you can see, charges from 110 are pending. And
okay, but these are charges that are coming over and pending charges from IM bills, correct?
Not IM bills. IM bills is not attached to this. This is from physicians in the office who are doing their visit notes, and they're entering the charges in the system, not IM bills.
Michelle, our facility charges that we're going to enter, will they be in this list?
No.
No.
Okay. So how would we enter one from the very beginning, since they won't be in the list?
Sure. So I'm explaining the different screens. So, and I will show you. So anyway, so let's quickly jump onto that then. So If you want to make a fresh charge entry for a person, so you would click on this first dollar icon. It will bring you to this charge posting screen. So obviously find the patient. So in this case, let's suppose test ed, and you find the patient, say okay on it. Okay. Then you pick the service date. So let's suppose in this case, this is for January 15th to Jan 15th. Pick the CPT code. I'm going to pick 99213. Then I hit tab. So then the diagnosis codes, if the patient already have diagnosis codes, it will show you on the top, but otherwise it will show you like a ton of frequently used codes, or you can search by the question mark saying, okay, I want to find the diagnosis that has diabetes on it, or you can just, if you know the code, you can just type, like, let's suppose E10, right? So if you know the code, you just type E10 and say, okay, I'm looking for E10.44, and you can add it like that, right? And you can do more as you go along. Modifiers, let's suppose this has a modifier 26. I mean, definitely not for 99213, but I'm just showing you. Place of service, charge, unit, copay, and that's the whole charge. It's already there. Okay. If you want to put this claim on hold for some reason, you can click on that and put a hold note. So basically what happens is you're entering the charge, but you don't want it to send to the insurance because you're waiting for whatever reason, then you can put it on hold. I'm not going to put it on hold. More options are here if you click on CPT, because sometimes you need to send like a note while entering, while sending the thing, like, column 19. I'm sure, pretty much everyone is aware of that. Like, you're trying to put an acquisition cost or something like that, whatever that is. Or, you want to put more codes on there, NDC codes if it has to go with the system. So anything that needs to go, like, or like more details on the HCFA form, you can access it by clicking on this CPT icon. So you can just like keep going, like tab on this, and you can go to the next one. Let's suppose this is an EKG that you want to bill. So then you can go to the next one. System picks the same codes, but obviously you can change them to what you think is right. Okay. And at the bottom here, this is the performing provider, and this is the billing provider. I'm sure because your background is billing, so I'm not going to explain those things. So obviously you know that. Case is if you want to build a case. Some like if you came from like the legacy systems like Medisoft and all those things, you know what a case means. So or it's basically more details about that thing. So you want to change it, or you create a new case every time. So what I do is I come here, I look at the existing case, and you give it a description, whatever, saying office visit, and you can put a hospital name, say this was seen here, and any other details referred by or things, right? So you can.
Okay, Chris, is this the case area here where we set the service facility so the proper name and address goes in box 32 of the HCFA?
Yes.
Okay, so if they were seen at the Baton Rouge General, West Feliciana, if they were seen at the West Feliciana Hospital, we would set service facility there so that it went in the proper place. So we're going to have to update the case every time.
Yes. So if they're seen in the same hospital every time, like every day, if they're 20 days in the hospital, then you can literally use the same case. But if you're right, if they're changing hospitals or something, I would definitely change the thing. Now, hospital is what you would pick. Facility is more like, skilled nursing facility or surgery centers or that kind of stuff. So it has to be either or, right? So you pick either hospital or the facility. Okay.
It's either or. So if they're seen in skilled nursing and we set it, that will properly link it to the place of service indicator that shows up on the claim? Place of service indicator. Go ahead.
So the place of service is something you already picked before you built a case. So you should have to like change this before. So you have to say this is whatever that is before you actually create a case. So you would already be picking that, whether it's a hospital or.
One quick question. When you did key the 99213, I wasn't paying attention to see if the place of service 11 defaulted or it was picked.
It is defaulted. So you can create that when you're creating your codes. So for example, this is the setup for CPT code 99213. And see this place of service? So I can say which one this is when I'm creating that service and how much I want to charge and all that stuff. Okay?
No, that's perfect. I just wanted to make sure it was defaulted for the standard codes, and then we'll edit it between inpatient and outpatient depending on where they're at. No problem.
Absolutely. And also, because I already opened the screen, I just want to quickly let you know, because this may be important. When you're creating CPT codes, you give it a description. Obviously, as you can see, that is editable. You can change however you want it. Fees are there. You can give them classifications, because tomorrow you want to know how much money you made from office visits versus something, you can classify them. Claim notes. So let us suppose this CPT always needs to go with some kind of notes. So let's suppose this is a drug and you always want to say something. So then you can put a claim note or a column 19 note. You can always auto add that. So let's suppose auto add and you always say something, right? So instead of your staff remembering it, you can auto do this. Now, there is a flash note also. What that means is every time you're billing this, you want to remind the staff or something, right? So every time you pick that code, the system is going to flash and say, hey, make sure you do this because this is something. It's going to give you a pop-up. And there are other things like anything that you want to customize. You don't want to build this code, if the patient is only between this year and that, like if they're 30 to 60, you want to build this code. Anything more than 60, you don't want, something like that. If you want to split that anesthesia or billing frequency, you don't want this more than billed once a year. So those kind of details you can do, or you want to say, if I'm billing 99213, obviously I don't want to bill a 99214. So you can say cannot claim with. So more details are there based on what you want and how much you can automate the whole thing so that, all these things pop up automatically. Okay. So let's go back. Okay. So pretty much here it's there. So you can say, the system automatically picks the primary insurance. So, and it says to be claimed. That means this is ready to be claimed. If this is already sent to insurance, it will say sent. And if it's already paid, it will say paid so that you can see in the future. So that's how you create a charge. So basically you save that and you're done.
Is there any, Chris, if we key 25 charges and want to double check our work, is there a report where we can run the transactions that we key for that user for that day to double check our work?
Yes. So I'm making a note. So I will, once we come to the report section, I will show that to you. So you want to audit daily charges. Okay. Definitely. Okay. So any questions on charge entry so far?
That was pretty straightforward. That was great. Thank you.
Okay. And one last thing, if you want to see the patient's note, if the physician used the EMR and you want to see the note because you want to read it to code it properly, then you can click this icon here and it will open that visit note attached to it. But obviously, if you're entering them on the fly without anything documented, then obviously it won't have anything. But if it is something, and then you can do it. Oh, and one last thing, sorry, the authorization. So if there is a pre-auth that needs to go with it, then you can put the pre-authorization number there. Okay, so that's pretty much it. We can create macros. What macros means is in our system, let's suppose you're doing a nuclear stress test, and it always is 5 codes. So you can combine all those 5 codes into like one shortcut, and it'll pull all the 5 codes like that. And yeah, that's pretty much it. So that's all for charge entry. Ed, what next do you want to see?
What if on the EMR side we're responding to medical records and need to, pull the notes from a day to send to an insurance company? How do we just locate visit records and notes and go ahead and, to print them or fax them.
Okay. So you see this chart view? Chart view is the whole patient's chart. So let's pull somebody who may have something, because your account was just created, may not have. Hopefully Ashley's account has something. Okay. So there are tons of documents here. So, okay. So once you click that, the chart view, this is literally the patient's chart. So you can look at, all their details, their last visit, next appointment, their balance, their weight, their insurance, blah, blah, blah. Now, these are all the documents. As you can see, every document has a description. So these are all the visit notes. So the patient was seen on all these days. So if you double click on any of them, you can see that day's visit note. You can click on email, which I don't think is set up, but you can do that if it's set up. Fax. So I think fax is definitely there. So you click on fax and you can say, okay, let me fax it, and hit fax, and it'll fax right away. If you want to add, let's suppose you want to send it to Blue Cross and their fax number, as you can see, is not added there. So you add the fax number and you can, send it to that, or patient, or anything. Or if you want to randomly send it to someone, so then just say other and say, I don't know, to Ed. And you can put the fax number there and hit fax. So that will be faxed out, right? Or you can print it. You just don't want fax, or you want to combine multiple documents and combine that and print it out or something, so you can hit print. Okay. So that's visit notes, and that's the same style if you want to fax or look at anything. So there are some pharmaceutical consult reports. So these are things that are scanned. So this document is scanned. So same thing, fax it, email it, save it, whichever way. Or if there's a physician, they can sign off on it and they can make notes. When we are doing it, if you want to be reminded on next appointment, you can click on prompt me on next visit or call the patient, whatever. So I know you're not looking for that. Okay, so let's keep going. So that's documents. These are strictly visit notes. Documents can be visit notes plus any kind of things that were scanned into the system on this patient. Visit notes. And Ed, this may be important for you, the face sheet. So face sheet has literally everything that is important when you're trying to send the patient to someone. Like it has their billing, their ICD codes, their insurance, their cases, and their, all these things. So this is something you may need, based on what you're looking for. So you can print it out. Diagnosis shows all the diagnosis of the patient. Labs shows all the things that were ordered on the patient. Prescription, immunization, vitals, billing. Scheduler shows all the appointments. Check-in shows how many times they showed in. Any notes that were made on this account. Any reminders that you created, and the whole thing, and faxes sent. So these are all the faxes sent. So somebody says, I didn't get my fax, you can go and then say, oh, no, that was sent, and because you were asking about faxing, it'll show whether it was success or failure, so you can resend it if it's a failure. And history just shows you all the things that anybody tried to access on this patient, so doctor. Okay, so yeah, this is the screen. Did I answer your question?
Yep. What's the different color codes, just out of curiosity?
They are created for when the categories are created, so they're based on the category. So they wanted to categorize them so they can know the difference between different things. So they made visit notes as pink. So if you want insurance cards to be a different color, it can come to that. So it's easy to recognize, that's all.
Okay.
And if you want to export this, like let's suppose you want multiple of them, okay, and export it, you can do that, or email it, whatever, okay. So next question, Ed, what do we have next?
I'm not sure, Chris, if this is a question for you or Guru, but how do we send accounts to collections?
That's a kind of a Guru question, but I think I don't know what do they do in billing, so I'm going to write that down.
Follow up. That's okay.
Okay.
What about, I should have asked when we were in the charge entry screen, but what about posting a refund?
Posting a refund. So that would be payment posting. So you go under billing, patient payment posting, or insurance payment posting. So are you saying a refund from insurance or from a patient?
Refund to a patient.
to the patient. Okay, so what I would do is I would go into the ledger, so which is the middle icon right here, and let's pull a patient. Okay, so let me explain the ledger a little bit, because I know you'll be looking into the AR piece of this, so this may help you. So if you go into the ledger, you will have all the visits of the patient. As you can see, their bill number, service date, and what the balances are. And at the bottom, you can see, the patient doesn't owe anything, the insurance doesn't owe anything, and there's an open credit actually, so that we need to give the patient back. So we can refund that, right? There are two ways to look at details. So you can click on the plus sign, and you can say, okay, so this 99024 was billed, and Blue Cross came back and said, we're not paying anything, or they're actually paying 1 cent. Okay, so, and the 1 cent was written off, right? So you can see the details in posting. Okay, same thing for others. You can click on, individual items and see what was done. Like, something was reversed, so it was like $100 that was posted, but I think this is a dummy account, so they want to reverse that so that it doesn't screw up the account. So you can see all those details. There is another view. If you click here to switch back to service line item view, what that is, pretty much it opens it in this kind of view where you have all the details instead of you clicking the plus signs. Okay, so let me go back and answer your question. So yeah, so let's do this one. So if you right click on the patient's credit, then you can say refund. So you can put the $5 and pretty much say okay here, but you still have to write the check. You're refunding that in the system, but you still have to write the check and do your process on that. Okay, so you can put, okay, this is the refund check, and you can put you don't have to put a bank number, but you can put the check number that you're refunding it on and the amount and blah blah blah. Okay, does that answer your question?
Yes, it does. Thank you.
Okay, so that's refund. Other things that are important in here is, I don't see any balance on this one, so let's find, actually we posted some charges on it, so let's go on to that one. Test comma ed. So, okay, on ed, we just posted some charges. So when you look at this, it says to be claimed, so obviously it's not even sent to the insurance. So there will be different statuses like sent and paid if they're done. You can double click on this and directly go to the charge if you're trying to make a change or something. If you want to rebuild this, so you can click on rebuild and click on rebuild service date. Obviously this is to be claimed, or edit it, delete it. Again, don't suggest deleting anything in IMS. Collection follow-up is the one that you were asking about, how to, if you call the insurance on this and say, hey, you know what, then you go to collection follow-up. Under collection follow-up, there are 3 different items. So one is the patient. So basically you're making a follow-up note on the patient level, right? So for the whole patient. Claim is you're only making a note for this particular date of service on that claim. And insurance, you're making that note for the whole insurance of that patient. So if you look at other service dates and look under the collection follow-up and go to insurance, you will see that note on the other ones too. But this may be a question for Ed, like where do they put the notes? Obviously, there are multiple places. ACE may have to answer and tell you if you're trying to see this and say, hey, was there any follow-up done, right? So
once you're done, we'll show you. Once you're done, we'll show them, Chris.
Sure. So click on collection follow. For example, I'm going to show you a quick way, how to put a note. So you can come to the screen, type your note up, follow-up note. It says entered by right now because I logged in as system, but generally it will pick the person who entered it. You can say, okay, I'm still pending, I'm still working on this, in progress, waiting for reply, or done, whatever. And you can put a follow-up date on this, saying, okay, I want to come back and remind myself. So then you can run a report and see all the notes that you want to follow up on January 31. So you can put like a 2 weeks note or something, whatever it is. So, and what all the notes will be here. So if you want to see previous notes, you can click that and you can keep adding more notes. Okay. So that's how you put a follow-up.
Where do those follow-up reminders come back to us? Is there a task list?
Yep, there is. I'll show that to you. It all comes under AR analysis.
Okay.
So let me close that. So here on the screen, this is the ledger screen as we talked about. It says N here. That means there is no payment plan for this patient. If you want to create a payment plan, you just click on that N. Whether you are sending statements or not. So in this case, yes, you are sending statements to this patient. You want to go to options, want to look at the statement history. So you call this patient and he says, oh, I never got a statement from you. Then you go into statement history, then it'll show all the statements that were sent on to this patient. And then say, yeah, we sent it on so-and-so date. Or if you want to quickly print out a statement, so you can click on statement and you can print out a statement, right? So that's that. At the bottom, you can filter and say, I only want to see payments or balances or something. I don't want to see all because sometimes it can go like super big, right? So that's the ledger screen. Basically, this is for you reviewing an account and see what's paid, what not, working on individual accounts. Any questions on that so far?
No.
Okay. Quick shortcuts here. You can quickly click on this phone icon. It'll show all the contact numbers, whether it's insurance or patient or anything. So if you're working on the AR, best way to call them. Patient's face sheet. And finally, the patient's insurance information. So click on that and I'll see what insurance they have and all that. Okay, so I'm going to close this one and I'm going to show you AR activities. This I'm sure you will like. Okay, so let's spend some time on this. AR activities is a snapshot of all your AR. You don't need to run separate reports. You don't need to, do multiple things. You just come to the screen. So you can have filters by office, insurance carriers, patients. Now, what is the difference between an insurance carrier and a plan? Plan can be Blue Cross or Blue Cross HMO. Plan can be Blue Cross PPO, Blue Cross Federal, Blue Cross something. Carrier is one Blue Cross, and all those other plans come under that. So carrier is the main, and all the insurance plans come under it. Okay. Obviously, AR by patient, aging dates, blah blah blah. So if you look at aging, there is a claim date aging, service date, and first claim date. Claim date is when that claim was sent. So the service date may be January 18th today, but it may have been sent to the insurance on January 20th. Sorry, first claim date is January 20th. Claim date, let's suppose if you rebuild it again on March 31st, then claim date will be that one. But you can choose which one, you want your AR to be run based on, your requirement. As of is basically what's your AR as of today. But generally, you already know, you don't want to say, last 60 days doesn't make any sense to look at that AR. Then you can go to like a November 30th or kind of thing. Status, don't worry about this. You can create statuses, I'll show you. Case types, don't worry about that. Filter on claim date or service date, same scenario. If you want the AR to be seen in particular time period, you can do that. Providers, if you're checking for a particular physician, insurance type, you want to pick a particular. So this, you want to only look at Blue Cross Blue Shield. These are the types that were created in the beginning. Patient type, remember. So you want to just look at based on that. You can do that. Insurance priority, again, same thing. You want primary or just secondary or primary plus secondary or whatever. Buckets, 30, 60, 90 are default buckets. You can change them. You want to look at a particular balance. You don't want like, $10 ones. You want anything more than 20 to 10,000. Hide 30 days. If you don't want to see the last 30 days of AR because it doesn't make sense to look at that, you can always check that box and it won't show you the last 30 days. You can group them by however you want, by office provider and all that. And there are more options if you are interested. Follow-up. So this was what you were asking before. If you put a follow-up date and I want to see all the follow-ups that I have and choose those dates. Rejection codes. When you're posting payments, right, insurance posting, you have all these rejection codes that you get. So if you want to do your AR based on the rejection codes and want to see what those are. Users, let us suppose you have a few users and you want to see the claims that are assigned to them, then you can do that. So you can assign a particular, suppose you want to take all the Blue Cross and want to assign it to someone. You can do that. Procedure codes, let's suppose you want AR only on a certain kind of codes. You want the AR based on the last statement sent, so a lot more options, right? So uncheck that. Let's just look at the whole AR. Now, before I do that, Michelle, anybody in the call that should not be seeing HMG's AR?
No.
No. Okay. So you just hit retrieve, and this is the full AR. This is the best way to look at your accounts receivable by insurance. Okay, so as you can see, this is the AR, to 0 to 30, 31 to 60, 61 to 90, blah, blah, blah. You can click on any of these brackets to sort them. So I'm going to click on balance because I want to see the highest ones on the top. So your patient balance is, that. So overall, from the day we started using IMS, your patient balance is that, your Humana balance is that. And now again, these are charges. Please remember that. So always your charges are twice inflated. So these are charges, and so in terms of receiving money, it will be half of it, or whatever, however much you inflated it, half or 60% or 70%, whatever it is. So Medicare, Louisiana. So let's look at that one. So you say, oh wow, there's $18,000 on this insurance. Let's see what that is. So you double click on it, and this will show you by patient. So these are all the AR. So you want to start working on that. Then you click on the balance and say, okay, let me start working on the highest ones. Okay. Okay. So then you say, it says Procedura. Let me go into details. So you say, okay, this is what 99232, 99232, 99232, whichever one. So this is how you can go into details and start working on the AR. Now, see like a red flag here. So what that red flag shows is there is a note on the system that ACE put. So if you double click on that red flag, it will say as per ability. So you can see that ACE followed it up on January 4th. So you can read the notes and any notes that you put. So as you can see, it's collection follow-up on claim level. If you put that note, then you can read it. So I would recommend you putting on claim level notes rather than patient or insurance, so you can read them here, right? So if there are more notes, you will see them as it goes along. Okay. So this patient, this was around November, so I'm hoping they will be paid. It's not like it's 60 days yet or close to that. So then you can work on this. So let's suppose you want to assign this claims to, I don't know, whoever. So you can come there and you can click on assign and say assign users. And you can say assign this to Robbie and this other person and push this out. And once you click this, then it'll go there. And those users, when they log in, they can sort it by only claims assigned to them. So if you are the main manager and you're trying to assign claims, or the billing manager, you can do that, okay, so that they can work on it. If you want to rebill all of them, obviously there. If you want to put a status on them saying, okay, I don't know why there's so many status created. So basically the status will be like, Medicaid pending, or as you can see. Was that a question? Somebody said anything?
No.
Okay. So you can create statuses of why something is pending. Again, majority of this is done by ACE, so I would, check with them what style they're following, because if you follow some style and they follow some style, it can get a little confusing. So after this call, I would let them answer how they, use this.
No, this is really, we needed. The real goal there was if we find a patient who had a denial for eligibility and we wanted to look at all of their claims or something like that, sometimes AR reporting is easier, sometimes patient ledger is easier. So I just wanted to, I've seen plenty here for our needs. That's perfect.
Good. Yeah, I mean, this pretty much is your mecca for all kinds of AR reasons, right? Okay.
Right.
Now, quickly, because to finish this off, so if you want to write off all of them because you're sending all this to the collection agency, then you can just click write off, put a code here saying self-pay discount or collection agency or whatever that code is. So then if you go under ledger level, it will say that these are all written off for a particular reason. Okay, so you can bunch write off all of them. And you want to create a letter to all these patients, whatever, you can do that. Okay, so that's pretty much how you can access. So this is AR activities, and that's that icon right there. Okay. Is everyone want to take a break, or shall we continue? Because I want to show reports really quick, because that may be the other thing you may be interested in.
I think if we see some reporting, we probably have enough for today's session, so I'm fine with going through that.
Chris,
okay.
I'm going to have to step off because I have a meeting at 10:30.
Okay.
But I'll catch back up with you for that piece.
Okay, and I will upload this session on YouTube, and I will send a link to everyone so you can go back and review it.
Okay, great. Thank you so much.
Thank you. Take care.
Okay.
So,
Bye-bye.
reporting, IMS have extensive reporting, and you will see that in a second why I say that. You click on reports, go to all. You can create your favorites too. That's what you want to do. So you can go into reports, and these are all the reports, and based on some users may not have access to it, some people do. So let's go on, starting with billing, and let's go to maybe, so under, there are tons of reports, like CPT analysis or aging analysis, revenue analysis. I'm going to show you a few ones which I like, and you can let me know if you're looking for a particular output. So I'm going to go to mid reports and go under provider productivity, right? So you can say for this position, I just want to see how they did, in a particular rate range. So let's say current month. It may not be much, but let's see. All the offices, all the CPT codes billed under anybody, and I want to see how Dr. Banda is doing, right? So you click that, and it'll give you this. So the report. So for this office, he made $1.52. So, and this is broken down by office, so you can keep going, or you can click this last page, and it'll show you for the full total. So basically, between 3 offices, these are the amount of units billed for different things. 23,000 in charges and about $1,000. And this is just this month, so it may not have been posted. So you can see how much was done on each, right? So that's one quick way of looking at a physician's productivity. So you can say, okay, they did 199 to 13 in between this time, so the units are here, whichever procedure they're looking for. So if tomorrow, Ed, if you're trying to look and say, okay, Dr. Banda should be doing more EKGs, but then this is the way you can look at here and say, oh, it's only one, something is wrong, we're not billing enough or whatever. Okay. That's one report I like. The other report is CPT analysis. Now, every majority of the reports have multiple options. So if you can go to CPT analysis and you can detail by all options, will give you a lot more things to filter. Summary by all options will just give you a summary, or you can just pick, okay, I just need to know by detail by CPT or detail by insurance plan. I just pick detail by all options because it's easier. So here you can search by service date or create a date, okay? Because this is a report for CPT analysis, you can say date of service or when we entered it, right? So let's do last November so we can get some actual data. So November, and you can pick all offices or whichever ones you want. Performing provider, if you want to see just the ones with zeros, then you can do that, or just say all. Performing provider versus billing provider. So that is important. So let us suppose all the claims for Dr. Panda are billed under someone, then you need to pick performing provider as Dr. Panda and whoever we billed it under the other doctor. You want a particular insurance, you can pick that. So basically, let me show you how to do that quickly. So you say include and say, okay, I just want to see this insurance. I don't want all of them, and just say okay. So it's a only running report on that. So I'm gonna take that out. Particular patient, particular CPT, particular referent doctor, blah, blah, blah. So you can go all the way down. How do you want the output look like? Do you want it to be sorted by the office, your analysis, or by provider or carriers, or you can pick what sort, what not, right? Then how do you want the report to be sorted? Do you want it to sort by CPT codes or by physician names or whichever one, right? So you can group them and sort them based on you like. Now, what do you want the output to have? Like you say, I don't care about office names. I just care about CPT and how much money we made, right? I don't care about patient names because the report may look like huge. So you can uncheck whichever ones you want. So in this case, let me run this quickly by provider and not even insurance, CPT, unit, charges, receipt amount, write-off, and maybe balance, right? And you can see how big you want the columns to be. You can do that. So let me run this report. So once you run this report, this is for all of November for all the offices. I don't know if I picked a particular doctor. This may be running for all the doctors too. Okay, yeah, it's all the doctors. So if you look at this, so it will show you a lot more details. As you can see, this is a huge report with 30,000 rows. So you can go all the way to the end and see, okay, totally 22 units, 2,000 units, whatever. This many charges. This is the receipt amount. Now, again, this is for more details. I wouldn't run this report if you're trying to just look at summary, right? But if you like Excel, a lot of people like Excel so they can do their own manipulations. You can always click on export. And how do you want this report? Like a PDF or text format, Excel, or CSV. I love the CSV format, so I would pick that, and so that you can get it like an Excel format and you can manipulate it however you want. So what I would do is click on CSV, choose a file where you want to save it. I want to put it on desktop, so say November AR or whatever you want to call it, and hit export. It's a very big file. That happened fast. I was hoping it takes a few seconds, but it happened very fast. So where is it? November AR, right? So this is the one that we just created. So then you can open it in this Excel file. And yeah, it's a big file. So then you can manipulate it, you know, if you, I'm sure you like Excel, everybody likes Excel. So you can manipulate it like how you want to do this, right? Okay, so let me go back. So that's one other report I like by CPT Analysis. The best report I personally run on pretty much all of my clients is this practice summary and billing by performing provider. This shows, again, it all depends on how much data we pick. Okay, that's fine. Let's pick all of it. It's a little too much, but let's suppose for all the month of December, right? So we can get a snapshot. So this is for all the month, again, breaks down by office. I generally like to go all the way down. So if you say, how much did Dr. Nalapraju make in the month of December? So this is what exactly this is. This report is great. Charges, insurance, payments for Dr. Nalapraju, patient payments, any open credits or overpaid amounts, refunds that we did that month, and total amount of money, total amount without blah, blah, blah. So, and his net AR, okay? And you then can say, Chris, what is net AR? This is the formula we use for net AR. So these A's and B's are shown here. What is an A and B? So total charges plus adjustments, blah, blah, blah. Okay. So net AR for December is $53,000 in this case. So you can see each physician, how much they made in that particular month. Now this changes as we keep posting more money in the next month, you know. somebody goes back and posts money into December, then obviously it'll change. But generally, it shouldn't change that much unless people are used to going back. So this is kind of like how much money physicians made, and how much money each office made, and how much money each CPT code made can be seen in the other one. Okay, so I like this report, practice summary. Now the other report that you requested is claims. Remember, you were asking how to run a report for all the charges that you entered. So you can go under billing, claims, detail by all options, and here you can pick the user, generated by, so include, and let's suppose you want to see charges entered by Robbie. Okay, then for which office, or claim date, or service date, or generated date. Generated date is the date that they generated their claim, right? So maybe you want to pick that one. Now, let me show you one thing. Let's suppose you did this for Robbie, right? You picked the office, you picked this thing, you told how to sort it, what columns you like. Let's suppose you do all that. Now, you don't have to do this all the time. So what you do is you click this plus sign, create a nice name for it, saying, you can say Robbie's favorite report, whatever. And you can say, every time I run this report, I run it today minus the last week. Let's suppose you always run this report for the last 7 days. Okay. And make this your favorite report. So if you click on this favorite, I'll show you what happens, and hit save. So next time you open this report, it will pick all this, whatever sorting parameters and everything for you. So I'm just going to run this real quick. Because we picked Robbie, I don't think she's entering any charges. So let's keep it open for everyone. And let's pick all offices. Select all. And I want to pick one date instead of like a ton. Okay, so that's the report. So it says the office, patient name, date of service, claim date, blah, blah, blah. And more, like how many units, claim balance generated, how we are sending it electronic or whichever way. Okay. So that's how you can look at some things. But again, if you want particular things, there are other reports that can achieve the same thing with different data. Okay. Now, how do you go into your favorites? So if you go under reports again, go under my favorites, it will directly take you there. So I just named this as Robbie's favorites. So basically you double click on that and it will come with all these other options that you picked already, like Robbie's name and all that. Okay. So that's how you can do reports. Now, reports is a great place to play around with because as I was saying, there are tons of reports. Billing, if you go under, there are, state outstanding revenue reports or financial reports, rejection analysis reports, if you want to do rejection analysis. Practice summary is the other thing I like, but other things are all mostly like scheduling reports and fax reports, which you don't need.
Chris, that was plenty. We really just wanted to make sure that we could check on our own work and kind of audit or review the accuracy of what we're doing before we really, tell ACE that we've got keyed claims to go kind of thing. No big deal. That was very helpful.
Okay, sounds good. So the next step is if you give us some names of who do you want access to, then I will have IT and ACE create those access. And obviously, any other questions, let us know.
Yeah, why don't we wrap this up for today? We'll send you a list of end users, and then if we have any more questions that aren't covered in video training, we'll just ask you or ACE and work forward from there.
Okay, awesome. Okay, thank you all, and I will download this video, send it, and I will also, Ed, if you can confirm that you received those previous videos so I can make sure I can send you the other ones.
Yeah, no problem. I'll get back to my, we're in the conference room. I'll get back to my computer in a second and take care of that for you.
Okay. Thank you.
Thank you all for your time today.
Take care,
Thank
everyone.
you.
Bye.
Thank you.